Students head back to the classroom. Schools may have to deal with a different kind of outbreak, the common cold, as we look to answer questions about the coronavirus and its impact on society. ABC 10 News reporter Jared Aarons takes an in-depth look at how schools will deal with health problems aside from COVID.
Because of the pandemic, schools are being more cautious with their students' health. They're treating every sneeze, cough, runny nose, or fever like it was COVID-19. Now, with more students in class, that means more germs to spread and more diseases to deal with.
We do know that we will probably see more colds as kids go back to the school setting.
Dr. Kenneth Morris, the chief medical officer at Children's Primary Care Medical Group, says it's only a matter of time before kids start to get sick at school.
Typically, when kids go back to school, within 1 or 2 weeks after they get back, we start seeing lots more visits at the pediatric and primary care offices.
This year may be worse than normal. 2 studies found that rhinovirus, which causes the common cold, spiked when kids went back to class. This study from Hong Kong found 482 school outbreaks in the first month after classes resumed. That included 81 large outbreaks, the same number that occurred from 2017 to 2019 combined. Researchers in the UK found a similar surge. They released this chart comparing rhinovirus in 2019, the red line, to 2020, the blue line. You can see cases nearly disappeared while the country was under lockdown. As soon as schools reopened, they skyrocketed to pre-pandemic levels. All those kids getting sick puts schools in a tough spot.
Even before COVID, we were always concerned about these things because the goal is to keep kids in school healthy so they can learn.
Poway Unified has had some kids on campus since January. Like many districts, they treat every sign of illness like COVID.
Pre-COVID, a child could be in a classroom with a runny nose. At this point in time, that doesn't happen. These are unprecedented times. And because this illness can affect certain people so terribly, we just have to err on the side of caution.
Several districts have rules like Poway's saying any child showing COVID-like symptoms must stay home for 10 days or get a negative test before returning to campus. Poway also had parents sign this letter agreeing to follow all the guidelines and keep kids home when they're sick. It may sound strict, but nurses in Poway say the system works. They haven't seen any outbreaks so far.
The process is working, and our children are in school, and I think people want to stay healthy. They want to keep schools open, and so I think for the most part, people are following those guidelines.
Dr. Morris says following the rules is the key for back-to-school health, and he breaks it down into 3 W's. Wear a mask, wash your hands, and wait to gather in groups. Doing that will keep kids safe from coronavirus and more. Jared Aarons, ABC 10 News.
We've got complete coverage of school reopening plans at 10news.com. And if you have a story that requires an in-depth look, we would like to hear from you. Send us an email, tips@10news.com.